With all of life's stresses, sometimes it's hard to keep those wrinkles off your face, but there is a way to fight facial aging. Dr. Michael Kim is here today to tell us more about the latest fillers that can help you turn back the hands of time. Good morning, Dr. Kim.
Good morning. How are you?
This is something so many of us are interested in because you do want to fight the signs of aging that are inevitable.
Yeah, it's the second most common procedure. Second to Botox, which is about 5 or 6 million a year. Filler is about over 2 million a year, so a lot of people are doing this.
What are some of the areas where you can use fillers successfully?
Well, you see on the screen, the most common areas are on the upper right, the nasolabial folds, which is a telltale sign of aging. The lips is very, very common in women, as you can see in the bottom left. And sometimes there's other areas like in between the eyes, the number 11s. We see the tear trough on the bottom right, that puffiness on the lower eyelids. You can put a little bit of filler right below that to kind of camouflage it. You can see the improvement from above and below of the eyes.
Big difference.
So pretty much some of them are off-label use, but pretty much around the face, even in the hands, sometimes we fill in the wrinkles to make the hands rejuvenated.
Every now and then, if you get this done by perhaps not as skilled hands, there are complications. What are some things to look for?
Well, as you can see, the complications here is they're overfilled. So you see on the left side of both of these patients, there's too much put in there. So now the shadow or the puffiness looks worse. So with the use of an enzyme that we have for all the HAs, which includes Juvederm, Restylane, and all those compounds, we can actually dissolve it. So you can see on the right, after the use of the enzyme, we can get rid of the excess, which probably means that the HA compounds that we use are probably the most safe that we have.
Okay, that makes a lot of sense. But at least it's, if you do have a mistake happen, it's something that's fixable versus surgery.
Right, and it's surprising that a lot of people who do the fillers aren't aware of the enzyme. And I don't know if there's a list you can show, but of the 2 million people getting fillers a year, about 1.8 million are the hyaluronic acids, which include Restylane, Juvederm, Restylane Lift, Restylane Silk, Juvederm Ultra Plus, Juvederm Voluma. And the reason is because of safety profile, because not only is it safe, but it's reversible. They're generally more easy to use. The other fillers I showed on the list are a little bit more longer lasting. So like the Radius and the Artefill, those are semi-permanent, meaning they can last up to 2 years. So if you make a mistake, they're not reversible. It's a big deal. So I think if you're a first-time trial, first-time doctor or first-time patient doing fillers, my advice is try to start with the hyaluronic acids, which includes Restylane, Juvederm. Use those first because if there's a problem, it can be reversible. It's very, very safe, and it's the most common one that we use.
Who should we be looking for to do these types of fillers, and how long do they last?
Well, I'm biased. I think a board-certified plastic surgeon is probably the best, but I mean, as long as the person that's doing it does a lot of it and is experienced, that's the most important thing. They have to know the anatomy.
Sure.
And they have to do a lot of it because, repetition and practice, certainly. So you go to a board-certified surgeon, dermatologist, someone who does a lot of it and can show you pictures and talk about it. Word of mouth is probably the best.
All right, Dr. Kim, thank you so much. As always,
Sure.
we appreciate it. And you're watching What News This Morning on WXCW.